Hello, my name is Tobias Martin, and this video is to explain the design and benefits of the MORA Feature light for Colour Studies DTB302. The MORA Feature light is designed to be implemented within medical reception areas to decrease anxiety and reduce its effects and the anguish of morbid anticipation. Before I dive into the design specifications, the context and reasoning must be explained. The MORA design is based as a direct response to the research paper entitled Lighting and Colour on Health Outcomes. The findings conclude that colour and chromatherapy can stimulate hormones such as melatonin, oxytocin and serotonin for calming practical effect. The reading also concludes that subconscious effects of healing are capable. However, there is a negative perception of colour design in the medical profession. The MORA Feature light is named after the process of amplifying colour to remove nerve pain and aims to maintain the reception environment as an addition to healing. The reception area as a space contains a large user demographic, including from infancy to elderly of all genders and nationalities. Therefore, the perception of chroma and intensity of colour differs between the user group and includes, on a polar basis, low tolerance of glare for the elderly and a lack of exposure duration resulted from low colour chroma. The form of the MORA Feature light is constructed with centralised circular glass shades placed within concentric circles. The concentric form allows the intensity of light to vary and create accent and visual interest, therefore increasing the exposure time of healing. The circular glass shaft acts as a shade that the bulb is routed into and transmits the light with a healing tint. The warm blue tinted light stimulates melatonin and serotonin to lower blood pressure, relieve anxiety and stimulate routine hormones. The bulb is a GE brand 32 watt that provides a dimmable 100 to 500 lux control from the reception desk. The MORA light is recommended for use at 300 lux. This is intentionally higher than Australian standards recommendation for a reception environment in order to allow the colour of light to be seen in cohesion with external lighting and daylight. The light is most effective when routed above the reception desk to increase healing exposure and cater to easy wayfinding. The light within the medical environment is routed at 450mm offset from the wall from a 2400mm ceiling. The form is manufactured through slotting unfinished mahogany within brushed aluminium to create a fixed base. This allows the product to be easily flat packed for transport or installed in full. The materials include the unfinished mahogany form, brushed aluminium routs and detailing, and a central glass shade. These were chosen specifically to diffuse or transmit light depending on the vantage point. When the user is walking to the reception desk, the light sparkles and shimmers to draw attention. However, when they are seated, the concentric circles block the direct light. However, the patient is still able to see the reflected colour. The MORA Feature light is a passive healing light with substantial medical benefits for patients and medical workers. The release of melatonin, in which Dr. Rhonda Patrick states, can only be converted to serotonin from the absorption of vitamin D in light. These factors will substantially benefit anxious patients by subconsciously lowering their blood pressure in the waiting room. The MORA light is also relevant to the medical professional as the warm blue's chroma intensity stimulates routine hormones that subconsciously stimulate the professional for a greater work effort.